I wanted to talk about flu and make sure that people understand what flu is and that it's different from just having a cold. So when people get flu, they get a fever, they get aches, chills and sweats, they get a headache, they get a dry persistent cough and a sore throat. They often feel fatigued and weakness for a long time. And those symptoms can persist for between 2 and 7 days. There are lots of other colds and things that feel a bit like that, but they're not as severe and they don't make people feel as unwell and necessarily the need to take to their beds. One of the things that we particularly worry about with flu is that it can lead on, particularly in vulnerable people, to developing more serious complications, people getting chest infections, bronchitis, pneumonia, ending up coming into hospital. And for a very small number of people, they can be at risk of permanent disability or even of dying because of that initial flu-like illness. And for us, in planning how we deliver our care here at the hospital, we're very focused on trying to minimise, where we can, the strain on the hospital, on people working at the front door in the emergency department during what will be a busy winter. So we're really working hard at encouraging people to take up flu vaccination, particularly if they're in a vulnerable group. And we understand quite a lot about at-risk groups for flu, and we target vaccination at them. So these groups are offered vaccination, they don't have to pay for it. We particularly look at children aged between 2 and 10, patients over the age of people over the age of 65, pregnant women, people living long stay residential homes, carers, healthcare professionals, and also those who are coming into contact with people who have compromised immune systems. You can get vaccination even if you're outside of these groups, and it's worth having a conversation with your pharmacist about that because it is available more widely. Many people have had vaccination done in previous years, and even if you've had vaccination last year, you should still be looking to have it again this year because last year's vaccine doesn't protect you against the strains of flu that are likely to cause problems this year. And though we don't know how it's going to be, we have got concerns that there have been some nasty flu viruses in the winter in the southern hemisphere, and often what happens here follows that pattern. So there's a lot of focus on trying to do the best that we can to protect our community against flu. Some people worry that having the flu vaccine is going to make them feel unwell, and that puts them off stepping forwards to have that. I think that's an understandable concern, but actually it's very rare that people really get any significant side effects from it. I've had the flu vaccine because I work in the hospital for many years, and it's never made me feel unwell in any way other than very minor soreness where I've had the injection for a few hours, and that's all. So this is a really important thing. Everyone should think about whether they're somebody who should be having a flu vaccine, and there's lots of information on our website. There's a web link coming up, and if you follow that, it'll tell you more about the whole issue of influenza.